student. Myself, Abhilasha Tiwari, Assistant Professor, Acropolis Institute of Pharmaceutical Education and Research, Indore. Today we will discuss the topic prescription, and the topic we will discuss in a prescription is a prescription, parts of prescription, handling of prescription. First, we will discuss the definition. A prescription is a written order from registered medicinal practitioner to the pharmacist to compounding and dispensing a specific medications for the patient. Or in other words, we can also say that the prescription is the written order from doctor to the pharmacist to compounding and dispensing a specific medications for the patient. The prescription is generally written in an English language, but Latin words or abbreviation are frequently used in order to save time. Next, parts of prescription. There is a different 8 parts of prescription. First, date. Second, name, age, sex and address of the patient. Third, superscription. Fourth, inscription. Fifth, subscription. Sixth, sign or signature. Seventh, renewal instruction. Eighth, signature, address and registration number of the prescriber. Now, we will discuss the different parts in detail. First, date. It helps the pharmacist to find out the date of prescribing and the date of the prescription for filling the prescription. The prescription which prescribe the narcotic or other habitual forming drugs must bear the date so as to avoid the misuse of the prescription if it is present by the patient a number of times for dispensing. Second, name, age, sex and address of the patient must be written in the prescription because it serves to identify the prescription. In case if any of the information is missing in the prescription, the same may be included by the pharmacist after proper inquiry from the patient. Also used in a dose calculation of the children. Next part is subscription. It is represented by the RX symbol. It is the Latin word. It means you take. In order to save in older days, the symbol was considered to be originated from the sign of Jupiter, god of healing. This symbol was employed by the ancient in requesting God for the quick recovery of the patient. And the next part, fourth is inscription. This is the main part of the prescription, contain the name and the quantities of the prescribed ingredient. The name of each ingredient is written on a separate line along with its quantity. In complex prescription, divided into following parts. First is base, second adjuvant, third is vehicle. So first base, the active medicament which are intended to provide or produce the therapeutic effect is called the base. For example, paracetamol, chloroquine, these drugs are used for the specific disease. Second is adjuvant. This is included either to enhance the action of the medicament or to improve the palatability of the preparation. Last part is a vehicle. It is included in the prescription either to dissolve the solid ingredients or to increase the volume of the preparations. Nowadays, the majority of drugs are prescribed which are already in a suitable formulations. The pharmacist is required to dispense the ready-made form of the drug. So, compounding of the prescription is almost eliminated. Next part is subscription. These comprises direction for the pharmacist to preparing the prescription and the number of the dose to be dispensed. Sixth part, signature or signa. This consists of the direction to be given to the patients regarding the administration of drug. It is usually written as a sign on the prescription. The instruction given in the prescription are required to be transferred to the container in which the medicament is to be dispensed so that the patient can follow it. The instruction may include the quantity to be taken or the amount to be used. Next, the frequency and the time of administration or application. Third, the route of administration. Fourth, the special instruction such as a dilution and the directions. Renewal instruction. The prescriber indicate on every prescription order whether it may be renewed and if so, how many times. It is very important, particularly in the prescription containing a narcotic and habitual forming drugs to prevent its misuse. It is the format of prescription. Sharma Nursing Home, date is 18th 1st 2020. Name of the patient is Mr. Nandlal, age 47 years, sex male. Where RX is a superscription. Next, inscription sodium bicarbonate 3 gram, compound tincture cardamom 2 ml, simple syrup 6 ml, and water 90 ml. Next is a subscription, signature, and the registered number of the prescriber. Next, handling of prescription. The following procedure should be adopted by the pharmacist while handling the prescription for compounding and dispensing. The first is receiving, second, reading and checking, third, collecting and weighing the material, fourth, compounding, labeling, and packaging. First part, receiving. The prescription should be received from the patient by the pharmacist himself. While receiving the prescription, a pharmacist should not be change his facial expression while giving an impression to the patient that he is surprised or confused after seeing the prescription. Second part is reading and checking. On receiving the prescription, always check it that it is written in a proper format, that is doctor's pen or OPD slips of the hospital and nursing home, and signed by the prescriber along with date. A prescription should always be screened behind the counter. In case of any difficulty in reading or any doubt reading the prescription ingredients or the direction, the pharmacist should consult the other pharmacist or the prescriber. Third step is collection and the weighing of material. Before compounding the prescription, all the materials required for it should be collected on the left hand side of the balance. After weighing the material, it should be shifted to the right hand side of the balance. This gives a check of ingredient which have been weighted. While compounding, the label of the every stock bottle should be read at least 3 times in order to avoid any errors. First, when take from the cells or drawers. Second, when the contained are removed from the weighing and measuring. Third, when the containers are returned back to its proper place. Next is compounding, labeling, and packaging. Compounding should be carried out in a neat place. All the equipments required should be thoroughly clean and dried. Only one prescription should be compounding at one time. All the ingredients should be compounded according to the direction of the prescriber. All the compounded medicament should be filled in a suitable containers depending on its quantity and use. The filled container are suitably labeled. White pen paper of a good quality should be used for the labeling of the container. The size of the label should be proportional to the size of the container. It should not be a very large or small. The label should be fixed with a good quality of adhesive almost in the center, leaving equal space from the bottom and the top of the container. The container should be polished so as to remove the fingerprint while delivering the prescription to the patient. The pharmacist should be explain the mode of administration, direction of for use, and the storage conditions to the patient. References. Thank you.